Call the Tuesday, July 27th, 2021, Reno County Commission meeting to order. This time we'll have stand for the Pledge of Allegiance and a prayer by Commissioner Friesen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let's pray. Father, we thank you for this day that you've given to us and the opportunity we have to do good work for this county and its people. We thank you for all those who dedicate their work every day for the betterment of our county and our community. We thank you for the freedom you've given us to govern ourselves. And we ask for your guidance today in the discussions and decisions we make. And thank you for all that you've given to us. In your name I pray. Amen.
Amen. Thank you, Commissioner. In the way of welcome and announcements, I just want to thank all the kids who were in 4-H and the programs that they did. It was certainly great to see what they've done as they brought them up for their different awards last night at the livestock sale. And you kind of know that the future's in good hands with those kind of kids. And also want to give a great big thank you to all the local businesses who help support the 4-H program, however they would do it, including at the sale, livestock sale. So that's all I have for announcements. And at this time, we'll go to public comments on items not on the agenda. Come forward to the podium, state your name and address, and limit your remarks to not more than 5 minutes per item.
So no microphone, just speak loud, huh? Okay. Brock Wells, 212 West Avenue B. I come today before the commission with just some comments and asking the commission that, you know, as we kind of gear up towards the fall, school starting and everything, and we see these, uptick in COVID cases, that asking the commission to not mandate masks going forward, and instead go the way of personal responsibility. We have been a very divided country on lots of different things, the masking, the lockdowns, the science even, and now the vaccines. We have a group, Dr. Fauci and the CDC and the KDHE and even the University of Kansas Health Systems that tell us to trust the science and trust the experts when it comes to the masks, lockdowns, and now, like I said, the vaccines. So, if you don't follow that along, you're labeled as having misinformation or getting censored from social media. Just like Dr. Robert Malone recently, who is credited with the invention of the mRNA technology that allows these vaccines these new vaccines to how they function. Anyway, he, just for stating that that we should have the right to choose between if we want the vaccine or not, he basically got kicked off Twitter for that. There's a lawsuit that just got brought up last week, I believe, in Florida. Florida. Anyway, accusing the Biden administration with colluding and censoring the American people with Facebook, and that is a very real concern when it comes to that. Then you have another group that very well-respected, decorated scientists, doctors, that look at the data and science and just say that there is there very little evidence that the mask mandates had much effect on cases, hospitalizations, and deaths for that matter. So basically what I just coming to ask today, is how to best move forward. And I really would think that, right now in Reno County, I believe that we are all doing this already. And that is basically the way of personal responsibility. If you believe that the masks protect you, and you're getting a little bit worried with the cases going up, then wear a mask and respect that. If you don't believe that the masks do anything, and you want to depending on your God-given immunity, do that as well. You know, the lockdowns, I think we're all in agreement on that, so we won't even go there. But and then hopefully we also keep the schools open. Hope you, the Reno County Health Department and everyone, the superintendents, keep the schools open this whole year. And then also, you know, with the vaccines, you know, Dr. Roger Marshall just had a article in the paper talking about, you know, if you have the vaccine, you know, then he believes that you have artificial immunity, you know, and if you've had COVID, then you had natural immunity, and both those together will protect you and from, you know, these new variants and stuff. So I just came to ask and state that today, that, you know, as we move forward, unless there's some overwhelming and compelling evidence that comes forth, which, you know, I personally believe is not out there, but unless there's some very, very good evidence come forth that shows that the mask mandates work, that we not, through this rest of this year, mandate masks and hopefully keep the kids in school. And we do that as what we are doing right now. And I think, like I said, we are all respecting each other's rights and responsibilities. So with that, that is all I want to say, and I appreciate you guys' time. And one more thing, I guess I got a little bit. I do appreciate the health department through this whole thing. I know that personally I haven't agreed with a lot of what, you know, the health department's, you know, been saying about these things, but you guys have been under a tremendous amount of stress and pressure, probably more so than a lot of people, and I do, you know, appreciate the way you guys have been going about that here in Reno County. So,
Okay, thank you, sir.
thank you.
Any other public comments? Carter, do you have anything? Are you on like comment on? Or?
Commissioner, I was going to add her to the agenda. Ask to add her to the beginning of the agenda.
Next one then, okay? Determine her additions or revisions to the agenda. Commissioner Sellers? Commissioner Friesen?
No, I think the only thing I would say is, well, I mentioned a little bit, is item 7A, is that needed today?
Yes.
And I feel like we're going to be tight on time, so anything we can do to keep moving, I guess, would be good, since we're going to add another item. I know we have an 11:30.
11:30, right.
I have one item I'd like to place on, business item 7C. I would like to place this motion for a business item to discuss, a motion to take from the table and set August 31st, 2021 as the date to discuss industrial wind energy conversion system regulations for Reno County and or any specific geographic areas excluded from industrial wind energy conversion system. Add that to it. Randy?
Yes.
I'd ask for a motion on that agenda item.
You may have another agenda item to add.
No, I'd like to, since we're adding items, I'd ask that you make that as a motion.
Okay, I would do that. Okay?
So we can decide whether to add it or not.
Okay. Randy?
I'd like to add Carla
I'm
Nichols.
sorry, I apologize, but if we're going to amend the agenda, I'd ask that you make a motion to amend the agenda.
Okay. I would do that.
Are you making a motion?
Yes.
Okay.
I'd do
That
that.
motion takes a second.
Yes. I would move to amend the agenda for the item I just specifically stated, to take from the table and set August 31st as the date to discuss the industrial wind energy conversion systems. I know it's been a long time, and so that's what I would do as a motion. Is there a second? Okay, go on, Randy.
Okay. like to add Carla Nichols to the agenda to give an update on COVID as things have been ramping up. She has a presentation for this morning, so I'd like to have her added.
Where at?
If we could do that at the beginning, maybe right after the consent, or right after Randy Regier. Either one, since he's also here for a report, so maybe put it as B.
Put it at B and put B down to C, all right? Okay, since we're being kind of technical on motions here, I would make the motion that we do add the Health Department to the agenda as item 7B and move item 7B to item 7C.
Second.
Moved and seconded. Roll call. Any more discussion? Roll call.
Commissioner Friesen?
Yes.
Commissioner Sellers?
Yes.
Commissioner Hurst?
Yes. Okay. That's the additions to the agenda. On the consent agenda, which is fairly long today. And if any of the commissioners want to take any one off and put to a different area, they may do that. Vouchers. And change orders 2021-456. The minutes of the meetings for June 22nd, June 29th, July 6th, July 7th, and July 13th, 2021. A Community Corrections Fiscal Year 2022 Kansas Department of Corrections Adult Grant Budget Adjustment. A Community Corrections Fiscal Year 2021 Kansas Department of Corrections Adult Grant Year-End Line Item Budget. A Community Corrections FY 2022 Department of Corrections Adult Carryover Reimbursement Budget. Community Corrections Fiscal Year 2022 Department of Corrections Juvenile Carryover Reimbursement Budget. Item H is a contract with King Construction Company Incorporated for the construction of Arlington Road Bridge, mile 17.55 for $1,117,096.95 with a cost share of 50-50 with the Kansas Department of Transportation, making the county's cost approximately $558,548.48. Item I is also a contract with King Construction Company Incorporated for the construction of Arlington Road Bridge 26.25 for $820,054.50 with the Kansas Local Bridge Improvement Agreement paying $200,000, making the county's cost approximately $620,054.50. We take a motion to approve the consent agenda as presented by staff.
Mr. Chairman, I would move that we approve the consent agenda items A through I.
Second.
Okay, moved and seconded.
Chairman, I do have a question. If Don Britton would come to the podium, I have a question for him on the two bridges. I noticed on the first bridge we had two bids, and they were what I would consider somewhat close together. And then on the second bridge, we had four bids, and there's quite a bit of spread between the high and the low. Can you speak to that at all, or is that just the way the bids came in? And why didn't we have more bids on the first item? And why would you see a $200,000 difference on the second bridge?
I can't speak to that exactly why that happened. I know on the one bridge where we got two bids, there was a contract company that talked to me that normally would bid on that. And he felt like the dirt work involved in that bridge within the city limits of Arlington was more than what we wanted to take on. Other than any of the other questions, I don't know why I've seen more or less bid on the bridges.
Are you surprised that the second bridge has a variation of over 20%?
Yes.
So you would suggest that maybe our bid that we got was an excellent bid for that project?
Yes, the Arlington Road Bridge within the city limits was $181,989.85 under the engineering estimate. So that was a good bid. The one 8 miles east of there was $59,225.50 under the engineering estimate. So whenever we can get bids like that, then I think they're good.
Okay. Thank you, Mr. Chairman.
Don, while you're up here, explain why, since we've had this come up before, why we're doing that one bridge in Arlington. Because it's a connecting link.
Well, that's why we're paying for that instead of the city of Arlington, being though it's within the city limits, is because it's a connecting link. Our county road goes into Arlington on one side of it and exits Arlington on the other side. It's a connecting link. So that's why we maintain all the roadway within Arlington.
Okay. Thank you.
These are all budgeted, Don? They're coming out of,
Yes, they're all budgeted in the special bridge fund.
thank you.
Thank you. Yeah, I might mention King Construction Company is maybe out in Reno County, but they're in the next door neighbor, and they're in Harvey County, so it's kind of a local business too. So that's good. All right, any further questions, discussion? Roll call, please, on the consent agenda.
Mr. Friesen?
Yes.
Mr. Sellers?
Yes.
Mr. Hurst?
Yes. Okay, going on to our business items. Community Corrections Year-End Grant Goals and Outcomes Report by Randy Regier, Community Corrections Director.
Good morning, Commissioners. Again, Randy Regier, Community Corrections. I'll keep my comments brief. This report is required by the Department of Corrections. It is kind of just a report out on the goals we wrote for the past fiscal year as part of that grant. These goals were all written pre-COVID, so if that kind of gives you any indication, some of these we did a little better on than others. There was a focus on training and coaching. A lot of the training ended up coming from the Department of Corrections rather than in-house because of some initiatives they had. But as the second half of the year came around, we really improved and got a lot more coaching done. It was difficult to do with social distancing in that first half of last fiscal year. We were going to do some auditing, worked on some auditing for one of our in-house groups. We were not able to do that just because of not having those groups for the majority of the year. I'm going to hit on the last goal that we have there, and that's the success rate. Again, the Department of Corrections wants us to have a success rate of 75%. We ended this year actually at 74. On the report, I have 74.2. We actually ended at 74.5. We had a late number coming in. We changed data systems through the Kansas Department of Corrections, and so some of the data that we're receiving is a little more challenging to deal with. But I did just want to point out that we were just right there, right under that 75% success rate, which I think is really good with the high-risk population that we deal with. So I think overall we did really well, and so I'll plan on submitting this report unless you have any questions on it.
Well, some of the challenge, and Randy, thank you for coming, and I didn't mean to say that your report wasn't important earlier. I know we have a lot going on today, but some of the challenges you mentioned with COVID, do you feel like those have been resolved now?
I wouldn't say resolved. I think we're making progress on those. Obviously, the challenges we had at the beginning of COVID were something that none of the people in our agency had seen or dealt with before, and so it was really a new ballgame. We dealt with MRSA and a few other things like that. But at the population we serve, in all honesty, tends to use something like COVID as a great reason not to have to report or not to have to do the things that they need to do. And so that's just been a challenge that we're going to continue to deal with. Some of the things we put in place are just going to be challenges that we're going to continue to deal with. But overall, I think that we've done well. I think that we've fared very well. When you look at the statewide, we're a small enough jurisdiction. We're about the 6th or 7th largest in the state, but we're small enough that we're able to take care of a lot of things in-house, whereas you have some of those larger jurisdictions, they have a lot of people in one building, and there was a lot of fear with spreading the virus.
Well, I was wondering, I imagine on one side, if you ask people to connect with you electronically, that might just be another excuse.
It is.
On the other side, is there a way to incentivize people to, FaceTime, check in, stuff like that, to where you could, actually kind of use some of the kind of challenges and make them into potential benefits for your efficiency?
Yeah, I think one of the things that's going to be interesting out of this too is that I think some of those things are going to carry over. Like you said, with those electronic meetings, I think some of that's going to carry over. We're using that still for some people we have out in the county. One of the challenges we just continue to deal with is that drug testing aspect. When you look at that being such a primary concern, that's one of our challenges. So one of the things that we deal with as well is the people that are really struggling with addiction or who are more criminally minded. They're the ones that we need to do the most work with, and they're the ones that are going to find all the excuses to not come in. We had people that couldn't come in for a month and a half because of COVID when they never even got tested. It's just excuses. So those are some of the challenges we deal with. But I really do think there's a piece of that we're going to be able to carry on with some of that mid-range group. You could break our people into three groups. The people that really, they'll do fine with us. They're really not going to need a lot of intervention. You have the people that they're going to go to prison. They just can't do that. They're not ready to make the changes. But you got this big group in the middle, and I think that's a group that you can kind of affect some change with. And I really think that's a group that some of those electronic things will continue to help, I believe.
Yeah, well, I'd appreciate anything you can do to make some of that permanent to the extent it is efficient and effective. So thank you for doing that.
Absolutely.
Any further questions? Randy, thank you very much.
Thanks, Randy.
We need to make a motion to approve that. I would make the motion that we approve the year-end grant goals outcome as stated.
Second.
Moved and seconded to approve the community correction year-end grant goals outcome as reported by Mr. Regier, Community Corrections Director. Any discussion? Roll call.
Commissioner Friesen?
Yes.
Commissioner Sellers?
Yes.
Mr. Hurst?
Yes. And Randy, thank you for your reports. You're always very, very, provide great information to us.
Thank you, Commissioners.
Thank you.
Okay, next on the agenda would be Carla, our Community Health Director.
Good morning, Commissioners. Carla Nichols, Director of Public Health. So we were here a couple of weeks ago, and we thought it might be a little bit more time before you saw me. But however, with the three-week trend on the COVID new cases that we've had, thank you for allowing me to be here and provide you with an update in our response plan. So we are updating the dashboard on a daily basis now because of those increased trends. We had a 3-week increased trend. So as of yesterday, we had 67 new cases. So because of that, we want to just provide you with an update. So on our response plan, oh, sorry.
I can click through or,
I can come get it if you would like. Is that easier or do you want me to?
yeah, if you want to.
Okay, so sorry.
That's, yeah. You should just scroll down.
Scroll. Oh, there we go. Okay, so, of course, 3 points to this response plan: vaccinations, testing, and then precautions. So vaccinations, something that you guys have all heard, I'm sure. A lot of this you've heard already. It's just a reminder. This is part of our plan. COVID-19 vaccines are available to anyone over the age of 12. We have Moderna, Pfizer, and Johnson & Johnson in the community. Sites in Reno County to get the COVID vaccine include the Health Department, Dillon's Medicine Shop, Walmart, Walgreens, Hutch Clinic, Prairie Star Health Center. If they have any questions, people can still go to the Vaccine Finder website and find locations inside and outside of Reno County. Vaccines are free to any Reno County resident, regardless of citizenship status or insurance. And for a ride to one of the vaccine sites, you can call RCAT. So we want to continue to remind people that RCAT is a great resource to our residents. They will provide free rides to and from any vaccine site to make sure that access is not an issue to get that vaccine. Testing. So COVID-19 affects different people in different ways. Infected people have a wide range of symptoms reported, from mild symptoms to severe illness. Symptoms may appear in 2 to 14 days after exposure to the virus. People may have symptoms of fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So if you are sick, you can get tested through your provider, or you can go to the free community testing site, and that is currently at Simply Good Overstocks in South Hutchinson. People can log on to gogettested.com for more information and then directions on how to sign up. Testing to treatment. So the Reno County Medical Collaborative has been meeting to discuss a common path for testing to treatment. If a resident is found to have a positive test result, those results are sent to the epidemiologist at the health department to follow up. The epidemiologist contacts the residents and investigates the case, including high risk factors for developing a severe case of COVID-19. They look at those risk factors, such as if you're 65 years of age or older, if you're 55 years of age or older and have heart disease, hypertension, or a chronic respiratory disease such as COPD. If you have a BMI over 35, if you have chronic kidney disease, or if you have diabetes. So when one of the criteria is met above for increased risk of COVID-19, the patient will be asked to seek medical treatment for monoclonal antibodies. Our epi investigation will contact either Hutch Clinic or Hutch Regional Medical Center at the numbers that they provide us for an infusion treatment to be arranged. And again, this is a treatment plan that is up to the patient if they would like, or if they don't like most treatment plans. That is up to the individual if they want to follow this way or not. But it is a way for us to try to lessen that severity and duration of COVID-19 should they have it. Precautions. The Reno County alert levels will mirror the Centers for Disease Control and the Kansas Department of Health and Environment updated guidelines. So that's what I'm going to go through with you. If anybody would like to look at those alert levels, there is a website. You can just Google KDHE, and you can Google KDHE Education K through 12. Last year, they did have different gating criteria, one for the community, one for the schools. They've changed that. It is one. With our meeting with KDHE yesterday, these are the current guidelines. They're looking at updated guidelines before school starts. So what I'm providing to you right now is what their guidance is right now. As they adapt, we will adapt. Again, the guidance comes from CDC to KDHE, and all of us are looking, of course, at those guidelines to make sure we can keep these kiddos in school once they get to school. The health officer continues to have authority over isolation and quarantine orders. And with the enactment of Senate Bill 40, which everybody is aware of, certain types of orders do require prior approval by the Board of County Commission regarding face mask, limiting the size of gatherings, operations of business, controlling the movement of population in the county, and limit on religious gatherings. So with all of this, we do want to remind community members to be vigilant in mitigating measures such as social distancing by more than 6 feet, mask wearing, sanitizing your hands, staying home when you're sick, and hopefully getting your vaccine. So with that, it is our recommendations. And again, these recommendations mirror those of CDC and KDHE. So on our dashboard, when our new case count is between 0 and 50 cases, will be at the green level. When the trend in the county, as far as our incident rate, is decreasing, when cases are rare, and again, we remind everybody to take those everyday precautions, and then it would be no limit on mass gatherings. When the alert level is yellow is when we have 51 to 100 new cases within that 2-week period. The trend in the county is stable. There's moderate to low number of cases. Again, there's increased efforts to limit personal exposure by taking those mitigating measures. Mass gathering limit of 250 people, large venues, arenas, stadiums at 50% capacity. Orange is when we're seeing 101 to 150 new cases. The trend in the county is incident rate is stable. There are many cases, including community spread, with detected cases likely. We remind everybody to limit everyday activities to increase safety. Mass gathering limit of 100 people, large venues, arenas, stadiums at 25% capacity. And at the alert level red, that's when we're seeing 151 or more new cases on a 2-week average. The trend in the county incident rate is increasing. There's a widespread outbreak that is growing with many undetected cases. We ask to take strong measures to limit all contact and mass gathering limit of 10 people, large venues, arenas, stadiums at 10% capacity. So projections. Reno County has 3,589 Reno County residents, or 27% of our 65 plus population that are not vaccinated. 60% of our residents are not vaccinated. So as of 7/26, which was yesterday, we have 67 active COVID cases. Nationally, cases were doubling every 3 weeks. It looks like we're moving faster in Reno County because we are far below the national vaccination average and about 6 points behind the state-wide average. August 11th, the projection is 168 active cases, and that would put us on track to be over 250 active cases by September 1st. So with that, what can you do? What can we do? And what are we asking the residents to do? COVID-19 is now a preventable disease for those that are eligible to receive the vaccine. Please get vaccinated. There's many reasons not to get the vaccine. Please find a reason to get the vaccine. Prevention is the key to good health. Maintain appropriate weight. Make sure you're working with your primary care provider to treat or prevent diabetes, hypertension, or other chronic diseases. Be vigilant in mitigating measures such as social distancing by more than 6 feet, mask wearing, sanitizing hands, staying home when you are sick. If you're sick and you think you may have COVID-19, please get tested. Call your physician or go to gogettested.com for testing locations. Be aware that Hutch Regional Medical Center and most Kansas hospitals are seeing increased admissions due to other health conditions such as stroke, hypertension, diabetes, due to residents not seeking medical attention during the pandemic last year. These patients are now coming to the hospital with increased health conditions. Along with this, several nurses have left the profession of nursing due to COVID-19 fatigue. Thus, there's a staffing shortage of nurses. In turn, this limits the hospital capacity for adding new hospital admissions. And you've heard this on the national news. The baby boomers are retiring, and we're starting to see a nursing shortage out there. Available nurses can apply for open positions at the hospital, and we need to encourage youth to go into the nursing profession to help lessen the nursing shortage. That's what we're asking the community to do at this time. So questions, commissioners?
I have a few questions.
Sure.
So one of the things that I think the intent of Senate Bill 40 was created for was to ensure that elected officials have a say in mandates specifically to COVID-19, but I think generally for anything related to health pandemics and so forth. So the challenge, I think, going forward is it seems like the health department understands that. At the same time, I think there are a number of entities, specifically schools and operators of large gatherings, that rely on the health department for guidance. And in the end, what looks like a recommendation from the health department without this board's approval becomes a mandate of sorts. I'll give you an example. I would expect, as things get worse, we're going to get into yellow, orange, or red this winter or fall. You're going to change the alert level, and that as a recommendation to reduce the gatherings. I think many operators are going to look at that as the same thing as a mandate. So I guess what I'm saying is I think this board, being the County Board of Public Health, should decide on the alert level policies that you provided here. I understand they mirror KDHE, but I'm a little I'm really concerned that there's no consideration for hospital capacity in the alert level. I think there's too much focus on case count because people that have the vaccine are getting COVID-19 again, and I think it seems like that's okay. People are handling that well, and it seems like everybody that has the vaccine is handling it very well and has not been in the hospital. So it seems like the government has created the right opportunity for people to protect themselves, and so I'm not sure I agree that the government should be involved in other restrictions, given you have the opportunity to keep yourself out of the hospital simply by getting the vaccine. So that was kind of a long way around the fact to say that I think the County Board of Health should review the alert level policy and approve that. But I mean, we're going to be in orange. I mean, it just feels like we're going to be in that in no time at all. And I mean, it's over 100 cases per 100,000, which for us is like 60 cases, right? So we'll be in orange when we have 60 cases.
And again, that guidance comes from KDHE. KDHE, again, told us yesterday they are still looking at updated guidance before school starts. So this is the guidance we have at this time.
Yeah.
They are telling us it is still under review. They will probably be updating it the next couple of weeks. This is the update we have from them at this time. That's what we provide to you, is the guidance from KDHE. It's the same guidance that KDHE provides to the Kansas Department of Education and to us.
Well, I think that's the whole point why we should take care of ourselves. Like they're trying to apply one policy across the entire state. That's clearly didn't work last time and probably won't work this time. So I think we need to take your recommendations, take the health department's recommendations. They need to bring them to us, and as the County Board of Public Health, we need to make our own decision. I just think it's blowing this way out of proportion to just use case count, given people have an opportunity to get vaccinated and stay out of the hospital.
I agree, Commissioner Friesen. One thing that I see is that taking one item and making everybody participate at that level is that we have a lot of sports events in the fall in high school and junior high. It is pretty proven fact that there is very little threat of obtaining it in an outdoor situation. But yet we're going to only allow 25%, or we're going to only allow a parent and only to come to an event. And I've done some mathematics with this on 6 foot. And if you got a family of 8, there's no way that there's a reason to limit the capacity to the extent that CDC and KDHE and whoever is trying to limit that. I see no reason for that. And so I would say that Commissioner Friesen brings up a good point with that. That I'm not sure that we want to get involved in other governmental entities and tell them what to do.
And what the Kansas Department of Education has told us time and time again, the decisions will be up to each local school district for them.
Yeah, but that's not what happens. Like, what happens is, and we saw this in the spring, even though it's their decision, they call you give a recommendation. And then when a patron disagrees with that, they call the school and they say, we disagree with that. And they say, well, that's what the health department recommended. And then they call you and then you say, well, that's their decision. And so it does this. And I want to keep that from happening again. And so I think the health department should, make a countywide recommendation here, whatever that might be, and then we make that decision, and we stay out of the business of micro or well, let me put it a different way. So I think the way Sedgwick County handled this was great. The Sedgwick County Health Department said they don't plan to issue any specific guidance on masks or other measures to schools, and they said the decision of county leaders in Sedgwick County has been to leave that decision up to the local school districts, period, right? I hear you saying that, but then I also hear you say, but we're going to recommend this, that, and the other, and I think that recommendation is easily leveraged into a mandate, and I think that should be from this body alone, not the health department.
Okay. Any other comments, questions?
Well, I've got one motion, but I'm curious what Commissioner Sellers thinks on this topic.
I think I agree with Commissioner Friesen. I think before I say much more, though, I'd like more information on, and I don't know whether Carla can provide or not, these 67 new cases that you're referring to. That's over a period of? Just a 2-week period?
That's the 2-week period.
Okay.
So last, on July 9th, we had 11 new cases. 2 weeks ago, we had 31 new cases. Last week, we had 47 new cases. Then starting yesterday, it was 67, so it was up 20 cases from the previous week.
It's just a rolling total of
It's a rolling
cases.
2-week average.
Okay.
Rolling
Thank you.
2-week cumulative average.
Is there any knowledge that you can provide us of these 67 rolling average new cases, of how many of those are vaccinated people and the severity of the vaccinated people versus non-vaccinated people?
Less than 1% are vaccinated people.
Of the 67?
Of the 67, less than 1%. We're almost seeing 100% here, but there is that one every once in a while.
There's just a small chance of
Yes.
a vaccinated person.
Yes, less than 1%.
That's what I've heard from other sources,
Yes.
but there's an awful lot of stuff out there, and you really don't know what stuff to totally believe, but your best information is 99% of the cases that we're seeing now are non-vaccinated people.
Yes.
Daniel, you follow this, would you agree with that statement?
Yeah, I agree. I think the more important, well, again, the government's provided the solution, right? It's the vaccination. If people don't want to do that, I mean, that's their choice, but I don't know that we should, as a government, be restricting activities because people have chosen not to get the vaccine, which is the solution, right? I think I understand the reason we went and did what we did a year ago, because we had no other choice at that point, and it was to protect people. Well, now we have the vaccine to protect people. So I'm just not understanding why we would create restrictive policy. I understand the reality is there's going to be more people that die because they're not vaccinated, but we can't force them to get vaccinated. And so I think right now our focus should just be to monitor the hospital, make sure it has the right resources it needs, and until the hospital's at any certain alert level that would require some sort of action, I don't think the government should be restricting activity.
I think I almost totally agree with your position. People have been given an opportunity to take care of themselves and take care of their family, and I'm not sure that I want to burden those of us that are doing the right thing because of those that aren't doing the right thing. So I would agree with Daniel that I think that the county commission should set the standards for the county. And the health department has given us what they feel is correct. Daniel, do you feel that 2 weeks from now we should have on our agenda to vote how to proceed in the future?
Yeah, I really think we need to look at the alert level guidance and approve that at the County Board of Health. And I would, if we're all in agreement on that, then I don't know if I need to make a motion on it. And I hope you all agree we could look at that in 2 weeks on the agenda.
I think that's pretty much an agreement that we look at this during the time. I think we've kind of all agreed that what Commissioner Friesen has said is the government may not be, should be active in the role that some want us to take. Would that be an accurate statement?
Well, the government's provided the solution now. It's the vaccine. And so I think it's just doesn't make sense to me to restrict people that on the premise that some people don't want to get the vaccine. It's okay if you don't want to get it, but I think that's the risk you take.
I share those thoughts. I'm not usually in 100% agreement with all the things you say, but I think today you've stated it very well. Is we've got a way to take care of ourselves, and if people don't want to do that, I'm not going to force them to. I'm not going to force the rest of society to
Accommodate.
be different due to the fact that some group isn't going to take care of themselves. And candidly, if the hospital gets so that they can't take care of people, they just can't take care of people. There's a shortage of, as Carla indicated, I think we do have a shortage of staff at local hospital, and that's going to show up if there's more people there, and they're not going to be able to take care of them. But as Daniel indicated, there's an answer to this that needs to be used. And so I totally agree that we should work between now and 2 weeks with a statement from this county commission of what we're willing to do. And as I think both of you said, that statement should say that we're not going to make decisions for school districts.
And just to take one of Commissioner Seller's points just a little further, I took a snippet of a tweet from a health administrator in Springfield, Missouri, and they said they lost 72 people this far in July, all unvaccinated. And so I think that needs to be the reality of that everybody that isn't vaccinated, and I think there is a reality here that people are going to die in Reno County that aren't unvaccinated because of COVID-19. And so anything people should reconsider, especially if they're at risk, take care of themselves with a vaccine. And I would like our statistics to show when we have a hospitalization or a death, whether that individual is vaccinated or not. Can we not show that?
Right now, there's so few of cases, it verges on being a HIPAA violation, so that's why I'm reluctant right now.
Well,
That's what.
But yeah, I heard that in some comments before, and then I kind of walked through that, and I don't think that's the case, because as soon as you say somebody is COVID-19 positive, I think you've already kind of breached whatever word you have. Because if you say there's one case and somebody says, well, Joe's in the hospital for COVID-19, well, we all know that's Joe now, right? Doesn't matter. Now we say, well, Joe's vaccinated or not. Like, we've already, when we're talking about people that have COVID-19, I think you've already risen to the level that you're concerned about, and I don't think categorizing them as vaccinated or unvaccinated goes any further. It's an important statistic.
If you haven't asked that, then how do you know whether only 1% has been vaccinated? Is that because of the records that you've kept of who got vaccinated?
That's part of the epidemiologist investigation.
You've got to know every time when somebody dies of COVID-19 whether they've been vaccinated or not.
Yes, sir.
So I think we need to know that.
Deaths only?
Deaths and hospitalizations.
Okay. All right. I think we have pretty good consensus on this. Agreed. May I add one
Thanks
thought?
for being here, Carla.
Yeah, thank you. May I add one thought with that? You mentioned school districts. Last time we got a lot of inquiries from businesses, and I would think that the businesses would go right along with the school districts.
Well, yeah, I think it should just be countywide. I don't think we should be picking one
Yeah.
entity or another. And
Being overall.
Commissioner Friesen, I think this is an extremely important issue. I think we all agree to that. And is it possible maybe for you to write a draft of a document soon?
Yeah.
And get to us so that we're not getting something Friday before Tuesday, and to know where we're going on this sooner rather than later.
I'd be happy to work
with staff
Randy
to create a
Karen.
document with Carla, please.
Thank you, Carla,
Thank you.
for the information and discussion. Next item, if we're done with that, no more questions or comments, is the staff response to South Hutchinson request concerning the Scott Boulevard Bridge by Randy Partington, County Administrator.
On the screen, I have the memo that was in the packet. This just kind of gives a brief history. At the last commission meeting, The commissioners asked staff to get with City of South Hutchinson and look at the alternatives. Their request of us paying 50% of their $700,000 bridge. We did meet with Mr. Turner directly after that meeting the next day and explained that staff's position was that we could not use budgeted funds for that were meant for county property on another entity's property, but we would be more than willing to help find cost savings, work with some engineers and try to find a bridge replacement or repair that was more than sufficient but would be less than that $700,000 number. We let the City of South Hutchinson know that. So today and yesterday, we had a meeting. Commissioner Hurst, myself, Don Britton, and Joe O'Sullivan met with some representatives from the City of South Hutchinson, including the mayor, a council member, and Mr. Turner, to discuss the county's position and make the offer again to help them find a better alternative than a $700,000 bridge. So at the end of the meeting, it was agreed that Don would contact his engineers that he works with on the numerous bridges that we take care of every year, have them inspect the bridge from underneath to see if it needs to be replaced or it could be repaired, get a cost estimate of what that would take to both repair and replace it, and then we would report that back to the mayor of South Hutchinson and then Chairman Hurst to kind of keep him in the loop of what was going on, and then move forward from there. What other assistance, if any, Reno County was willing to do. So that was the recommendation from yesterday's meeting. That was the offer we put on the table. And the City of South Hutchinson, the mayor and council members seemed in agreement. That was a great next step.
So what's the status on the hostage situation?
The Avenue F road, they are boring water lines, and from our understanding, that would probably only be one lane closed. There would be some closures off and on for some traffic, but we don't feel they have the legal authority to block a so-called resident of South Hutchinson. We are in the city limits of South Hutchinson, our building. So for us to get from one part of South Hutchinson to another part, if they put barricades up, we would have to go around those barricades, or I guess I would leave that up to Joe if there's anything else that we would need to do.
But the status, like, are they still threatening that?
The council member and the mayor said they would work with us and they would not barricade us.
The water lines are all on the north side of that on the north sides, and it's not a narrow road. It is a good width road that I think what Randy was referring to, that in case they get some machinery and equipment that has to temporarily turn or be there to do any boring, which I don't foresee, but it could happen that that street would be down for a short period of time just during that, and the county could work with that.
But that's not what the letter said. It was like
No.
closure.
No.
So that was a bluff.
The mayor and council member said that they would work with us to as it's the road itself is for local traffic only, and the businesses there that qualify as well as the county that are classified local traffic.
I think the county staff has done a great job, and Mr. Chairman, I appreciate you having meetings with South Hutchinson individuals yesterday to better clarify what our position is. We do need availability to move our trucks, and we think that we have that right to do it. I'm very proud of the county offering to help mitigate the cost on this project if that's possible. And to my knowledge, we have people on staff and able to work with appropriate engineers that might be able to save South Hutch significant money on this project. So I think it's moving well. I'm pleased that we're taking the position that we don't pay for roads that are not in our domain to take care, or bridges, I'm sorry, to maintain. I just had the idea last week to check with the city of Hutchinson to see how many bridges that are not on connector roads that the city might have of Hutchinson. The number is 66. So I think our position is pretty good that we want to stay away from non-connecting roads.
I especially want to thank Don for all the work he did. He did a lot of research and going back through a lot of years, and that was very beneficial to both parties to understand the history. And Joe being there and Randy being there, that was really good that we had that information. And so he spent a lot of time and work with that, and a lot of other time involved. So,
Well,
this, go ahead.
no, I was just going to also thank staff and Chairman Hurst for the work on this. I mean, there, as I stated last meeting, I mean, there is, I mean, we do need to be cognizant, absent the way this was handled by South Hutch City Administrator. To take that out of the picture. Coming from the city of Bueller, there has been, and I think South Hutch has experienced it, and maybe other cities have experienced, just a feeling of just very strong rigidity and lack of partnership. And I think we can find ways to partner with our county cities and still follow some of the policies that are intended just to keep things appropriately funded and equal amongst everyone. So I think if the one thing we learned from this is that, you know, again, it's unfortunate that some of the things have been handled the way they have by the city administrator. So it's hard to like have a conversation about how we can do better. But I think there are things certainly on our end just to make sure we have just an open conversation about how we can help and how we explain, like, okay, here's the policy, but here's how we can help. And I think we got to that point. It's now lost in the kind of the some of the pettiness of this. And so, like I said, I appreciate what we're doing, and I think I really like the idea of us leveraging kind of our non-monetary resources, like Don's expertise to help. So I think those are all good things, and I just wish we
think there's one
would have figured this out in a different way. Just a way.
one comment, and I appreciate that, commissioners. But Matt and I, the mayor, Matt Nisley, and I have had conversations going on for about 3 weeks on this, and we had planned on getting together later this week, and situations arose that we just needed to meet earlier. And I don't think I'm going to go into that. But from that aspect, I would offer a motion here with regard to, Randy, do you have anything more?
I didn't have anything. The only, I guess, one other thing, I just want to thank Don Bretton for his work on the research as you did, but to also mention that a couple years ago, and this was before current council members, before the current city administrator, Don had done some of the behind the scenes work to help find an engineer and cost estimates. As soon as the bridge did receive a weight limit that was below what we could drive some of our big trucks on, Don did reach out to South Hutch to help them, but that staff and council members are no longer with South Hutch, so they may not have been aware of that. But so Don has done this before for South Hutchinson. Started the work. I just wanted to make sure.
That was offered 2 years ago and fell through by the city council and staff there that didn't follow through with that. Thinking of something else I was going to say before this.
You were going to make a motion to do something.
I was going to add one more thing, but I can't remember what it was. My motion is the following. Commissioner is saying. I move that the request from the city of South Hutchinson for the county to pay for a portion of the cost of repairing or replacing the Scott Boulevard Bridge be denied for the reason that the county has no legal authority to use road and bridge funds or general fund revenue for that purpose. Further, I move that the county administrator and the county public works director explore what means other than direct cash assistance is available to the county to assist the city in reducing the cost of repairing or replacing the bridge, including inspecting the bridge for potential rehab and repair, obtaining a cost estimate from a qualified engineer, and to report their findings and conclusions to the mayor of South Hutchinson.
I'll second that motion.
Can I see that?
Yes, we can. Okay, it's been moved and seconded. We'll wait a minute here while Commissioner Friesen looks that over.
You know, the only thing I don't like about this motion is I'm in agreement that policy would dictate we wouldn't pay for this. I'm not necessarily in agreement that we have no legal authority to do that, being it's within the county. So I guess I've never seen any statute that says county pays for all kinds of things. And
We talked about that yesterday, and Mr. O'Sullivan had the statutes that have to do with budgetary, and gave it to us that day. So, Randy, do you want to comment on that?
Yeah, there's various statutes that set up funds for the special road fund, public works road and bridge fund, and the general fund that's specified for county purposes. So that would be the interpretation based on those statutes. I don't have those statutes with me, the numbers, but Commissioner Friesen, I can get those to you.
can we just get them now? Like with it says county purposes. That's
Well, I don't know if it says that's my interpretation of their
Tax jurisdictions.
I'd have to look at the statutes and pull that up, which I don't
that
have.
area is being taxed by the county, right?
Certainly.
I'm just not a little. That's the only thing I'm uncomfortable with. But I think it unfairly boxes us in, and
Okay. Any further discussion? If not, all
well,
those in-
is there a statute that you can?
There are three of them.
Yeah. What are
There's also in the Kansas Association of Counties County Desk Book, provided to county commissioners. There's a extensive discussion regarding county financial structure, budgeting, and restriction of the use of appropriated funds, levied funds that are appropriated for specific purposes, and I'll try to get that to you. I think that probably has been handed out at county commissioner orientations for new county commissioners. But the statutes involved three statutes that are used to fund county road and bridge maintenance and replacement. And not only for bridges and roads on county roads, but also bridges on township roads and connecting link roads maintenance, which the statute makes the county's responsibility. So the funds available for that come from the County Road and Bridge Fund, which is authorized by KSA 68-500101. It comes from the Special Road Fund, which is KSA 68-559, small letter A. And the Special Bridge Fund, a levy authorized by KSA 68-1135. And each of those statutes specify the purposes for which monies levied in that manner will be spent. And that's the basis for my legal opinion.
Does that help answer? How do you want to look at those before? But
I'd call for the question.
all right,
You got a second?
I'll second.
So we're voting on the call for the question. Is that it?
Yeah.
We'll do that now. Roll call.
Commissioner Friesen?
No.
Commissioner Sellers?
Yes.
Commissioner Hurst?
Yes. Okay. Now we'll further discussion on the motion.
No, you gotta vote now.
Yeah, I think so. We called for the question and that was positive, so we need to vote.
Now we'll roll call on the motion.
Commissioner Friesen?
Yes.
Commissioner Sellers?
Yes.
Commissioner Hurst?
Yes. All right. And
One thing I would ask, and I don't know if it's, just, and if these are available ahead of time, anytime we can get these out just a little earlier, I could have not,
been nice, but we got done with that meeting about 3 o'clock yesterday afternoon.
even if it's
morning,
in the
so, yeah.
even if it's in the morning, anything sooner the better.
All right.
Thank you.
Consideration taken. Next on the agenda is item 8, which is expansion to 5-member Board of Commission for Reno County. Review and consideration of adopting a resolution dividing Reno County into 5 commissioner districts. With that, we each had chosen some maps. Jenna.
Good morning, Jenna Fager, Deputy County Clerk. There are 3 different resolutions. The first one is based off of map 5 back here, out of the 3 maps that you guys had chosen to look at. The second resolution is for map 6, which is right there. And then the third one is for map 7. The resolutions outline which precincts are in each district if we do go to a 5-member district.
Okay.
Mr. Chairman, it seems like we're always nitpicking on issues, and I guess I have a question: is do we do A before B, or do we do B before A? It seems like to me that we got to agree to call for an election, and then if we call for an election, we need a map. But am I wrong in that order?
I believe that you have to outline which districts are going to be
For the
five-
item
the
B.
districts, and then
Okay.
you'll go to.
I
item B.
understand. Thank you for clarifying that.
Okay, so,
So the discussion is on map 5, 6, or 7.
I think they're all good maps. Does anybody want to look at them specifically right now? We've looked at them a lot, I think. I'm going to look at it.
Daniel's got 6 in his hand.
Commissioners, also behind Jen is the current map of the 3, just so you can kind of see as a comparison of what the 2 additional districts would, kind of how it changes things. In addition to adding 2 new members.
Of those 3, I'll start. I think map 7 is pretty decent.
That one?
That's the original one.
I'm just gonna pull it up on my computer.
Okay. That way you can zoom in.
Mr. Hurst, while he's doing that, why do you prefer 7? 6 and 7 are very, very close to the same thing. Is there a preference for 7 for some reason, or just
No specific
you flipped
reason.
a
I
coin,
didn't.
or what?
Well, kind of. I thought that it gave a good mixture, if you would. 6 is also a good map. But, 2, I like the mix.
I think last time I said that I favored 7, and I'm comfortable with 7. It seems like to me that 6 does a better job of focusing in on that one district of that total Hutchison district. It seems like to me that 6 tightens that up, and 7 makes it kind of wander all over the place. And you know.
Email with the link. Lost it.
So I'll vote for either 6 or 7, whatever the majority want. But I think from looking at the tightness of, is that District 4, the gray one, Randy?
Yes, District 4 is the one that's only in the city of Hutchinson.
To me, this is spread out a lot, and on 6 it's tightened up, and I'm not sure that this makes a lot of difference, because even though we're voting on these districts, I understand that after the new census comes out, we'll have to realign these districts per the population on that census.
Should they
And
change?
should they change enough to be realigned, and that'll come out the first of next year, I believe. But all things given, I would vote for number 6 before number 7, but to get consensus on either one's fine.
Yeah, they're very similar. I agree 6 is a little more clean. What I guess I would be curious again, what are you seeing between 6 and 7 that
I just, territory. What?
yours in particular?
Territory. It's kind of splitting up the total mileage, total area. 7, but I could go along with 6 too, because of that does kind of looks almost like gerrymandering,
Well,
doesn't
and
it?
then
Yeah.
I don't think any of the 3 of us are trying to create any gerrymandering at all. That we're just trying to make 5 equal population districts out of this. And so
It just looks like it.
I will.
6 is fine.
I'll make the motion that we approve the resolution that is concerning map number 6.
That would be resolution 2021 dash.
Fourteen.
14. Okay. there a second?
A second.
Moved and
I
seconded.
was gonna make a joke to just change one thing on there, but never mind.
You sure? Now, we're
Come
positive.
on,
It's a
Daniel.
joke. Come on.
Yeah. I think number one, I can say I had no real input on the design of this, but whoever did do it, it seemed like it was well thought out and fairly or very objective, I would say, and it makes a lot of sense to me how it's broken up. You've kind of it makes good sense. You've got kind of a Haven area now and a Nickerson area, and yeah.
Yep.
So, and I like how District 4 is still solely the city of Hutch. That makes sense too. So.
I think it should be stated to the public that I don't believe any of us commissioners had anything to do with any of these maps being made. That was the IT department to make them.
Yes, York and the
equal.
IT and Jenna worked together to have the maps created.
Okay.
So
So,
it's a good point, Commissioner
Jenna,
Sellers.
is this you're doing then?
I wouldn't go that far.
You wouldn't go that far.
No, we just kind of put them together.
But my motion
population-wise.
suggests that map 6 makes the most sense for the full county.
And,
A second, the
It's
motion.
been moved and seconded to consider or to adopt a resolution dividing Reno County into 5 commissioner districts, with the commissioner districts being designed as map 6. Correct?
Yes.
They're composed of the voting precincts. That's the most important part of it.
Yeah.
But they are, the territory of the precincts and the townships and the wards comprise each district, and the map is a good representation of that. But the actual technical application is on the resolutions.
And each district is outlined by
And
precinct.
Jenny, you would agree that the map 6 resolution equals this map 6?
Yes, Donna and I went through that with a fine tooth comb.
Good.
All right. Further discussion? Question? Roll call?
Mr. Friesen?
Yes.
Mr. Sellers?
Yes.
Mr. Hurst?
Yes. We'll have that in the sign here, resolution for map number 6. Just give me a minute and I'll get this out so we don't confuse it with 5, 7, or other things. All right. The next is to review and consideration of adopting a resolution calling for an election pursuant to KSA 19-204 on the question of a change in the number of county commissioner districts.
The resolution's in your packet. It's to call for the election. It also has the wording that will be on the ballot for the November 2nd election.
I'd like, Mr. Chairman, I'd like to speak to this just for a brief moment.
Yes, sir.
During the process that we've gone through the last 3 months or so, I've tried not to repeat the reasons that I think that going from 3 to 5 are appropriate. But I would like to add one more reason that I think that 5 is better than 3 for the future. Just this last week, the county administrator sent us some information on future county budgeting. And I believe, I'm paraphrasing Randy's words, but one of the reasons that we hired the present county administrator was he has some degree of expertise in priority budgeting. The county is not growing substantially. The tax base is not going to grow substantially. And in the future, county commissioners are going to have to make decisions on what priorities we're going to increase. And thus, if we increase some, we're going to have to decrease some. And so the budgeting process is going to get more complicated in the future than it's been in the past. And I totally believe in this priority budgeting that the county administrator is going to do for next year. And I believe that more people should be voting on a budget that will have some departments increasing their presence and some departments decreasing their presence. So to me, that's another good reason for 5 commissioners instead of 3.
Any other comments? So I believe we don't have a motion yet, but I will have a motion
Well, just to start the discussion, I would make the motion that we approve Reno County Resolution number 2021-15, which is a resolution calling for an election pursuant to KSSA 19-204 on the question of change in the number of county commission districts.
Second. Moved and seconded to approve a motion to adopt that resolution calling for an election, as Commissioner Sellers just repeated. Any more discussion?
Yeah, the one thing that I think came up in the last meeting and was a concern of commenters that sent me comments was the timing of the either appointment or election of the 2 new commissioners if this passes. And 2 weeks ago, I think might have put it in a motion, but I don't remember that we state that it's our intent to have that done at the next general election. And I don't.
Instead of appointments being taken for a short period of time to
and
allow the election to elect those.
Well, and I don't know, maybe we could get some clarification on that, because I didn't understand it. I may have stated it wrong, but I didn't understand it to ever be an appointment situation. It was either it was going to be a special election.
Yes, a
right?
special election or the general election next or in November 22.
So neither way, the new commissioners, there's not an opportunity for them to be appointed.
That's correct.
Is everybody in agreement on that?
Yes. Joe?
Yes.
That's right.
Well,
It has to take an election.
It takes an election. The candidates will be picked by the political parties by nomination. So to some extent, it's not like a wide open election with a number of qualified people, but that's how the initial vacancies are filled. And then the very next election after that, be a normal election for county commissioners.
All right.
I'm confused.
Yeah, Joe, that's not what our understanding is that if the general public in this election votes to go to 5 commissioners, that with the agreement of the governor, we can not fill those 2 new commission districts until the next general election. That's the way I understood your wording.
Either at a general election or a special election called for that
Right.
purpose.
But you just a minute ago said there'd be a interim period or something.
Well, it's a technicality. I probably shouldn't have added to the confusion. It's just that somebody said, I think Commissioner Friesen was talking about, it won't be filled by nomination of the governor, and that is true. That's the process that's gone. But the legislature has provided that if you went for a special election, then the political parties had a period of time to nominate candidates for that because of the shortness of the special election. But if you don't go there, then that process is out.
And that's the thing that's negotiated between the governor and the county?
Yes, and Donna checked with Leavenworth County, which, in which most recently, the collaboration which the statute requires the governor to have with the local county commission as to which election, special or general, it prefers. Donna, you relay that conversation, as we were kind of interested in how that actually works.
Donna Patton, County Clerk. Mr. O'Sullivan asked me to contact Leavenworth County, so I did. And they voted in November, but then they wanted a special election. So their special election was in March or April. But she said they did collaborate with the governor. They told the governor what they wanted, and then they relayed that down to him, and that's what was given back. So you do have a collaboration with the governor on what you choose.
So how was the slate of candidates determined?
It's voted on by the precinct committee people, which is what Joe was talking about on the Democrats and Republicans.
Special election.
They'll get together and then they'll choose which person they want on there, and then it would be a special election countywide.
But my understanding of the conversations I've had here in meetings with the two of you, that our preference is not to have a special election, but to leave those districts open until the next general election.
Yeah, I think that would be best for expense and just most appropriate that the people get to pick, or people get a run if they want. So can we state that somewhere? That's our intent?
Is that an option we can do?
You mean to state that you want the election to be held at the next general election, and you would, once this passes, if it does pass, then the governor's office is going to be in contact with you, and you're just going to tell the governor at that point that you want to go until you want the November election,
We
or the next general.
We could leave that open and let the decision be made by the public at the next general election.
Correct. The governor's office will be in collaboration with the commission on which way they want to go vote.
Do I understand it also then that in order to do if this would pass, okay, that then in order to do any business, any meeting, all three of us would have to be there?
That is correct. Your quorum would be 3. So if somebody can't make it, you can't have a meeting because you're now 5. Your quorum is 3. So if somebody's gone, then you're going to have to cancel a meeting. That is correct.
Why can't we just make it effective at the next general election? That doesn't make any sense.
Because it says
The
it's
statute says when it's effective. It's
Yeah.
effective when the voters approve it.
right. Yeah, you don't get to delay that effective. So
I think
Can we pull the statute up? I want to read the statute.
I think that's a minor.
It's not. It's
do you have
3
that?
to get together.
Do you have that resolution? It should say at the top of it what the statute is.
19204, is that?
Maybe
204 or 203A. I sent out I'll go get the statute book.
look it up. Don't get it just for me.
Well, do I do or not? I mean, I can review the statute.
I can look it up here. KSA 19204.
204 or 203A.
To me, Commissioner Friesen, I think it's a moot point because I think some people would be concerned about a special election. So it would be my suggestion that if this is passed today, that we get with the governor's office and say, would you allow us to do that general election situation? Because I think more people would vote for it if it's a general election instead of a special election. So I would hope that before we have the election that we have a concurrence of the governor on approving the general election.
With regard to selection of new
commissioners.
selection of new commissioners.
What I heard was when the people vote on it in November, that changes our quorum requirement
Yes.
until the next November.
Mm-hmm.
That doesn't make it.
I think we can manage time when all three of us would be here.
Well, and correct me, Joe, by Zoom attendance, is that proper attendance? It has been in the past for
Sure.
a commissioner to attend via
Telephone conference.
telephone even.
Yeah.
So I don't see that to be an issue.
I agree.
I'd like clarification on whether that's actually a statutory requirement or not. It's not, is that, I'm not holding anything up, I just like clarification.
You want clarification of what?
Whether,
Are you worried just about quorum?
On any time you have an election, it's effective as soon as that election is over with and we certify the results to the Secretary of State's office. You can't ever delay an election. Once it's done, it's done.
Commissioner Friesen, we probably can do some research to see, even though it's effective, if the quorum takes, just to verify how the quorum works during the time when there's only 3 of 5 commissioners when there hasn't been an election yet. We can see if we can get clarification.
why don't you just make the ballot question state that? And then it'd be effective, make it effective November of the following year.
I don't think you can delay an
The
election.
statute says
Yeah.
otherwise.
It's not delayed, it's
But-
whatever the election says.
We would have to change the resolution then. And we have a pretty strict time limit on this, don't we?
That's correct. And we would have to research and find out if you can even, if that's even possible, that you can have an election in November and it not take place till the next November. That's never happened before.
Right.
So I don't know that it can, so we'd have to research that.
See, have we had a motion yet?
I think we did, we had a motion.
Motion and a second?
And we had a second.
Yes.
So I'm ready for roll call. I can wait a few more minutes if we need to. Reviewing these statutes could take some time. So
Are you waiting for me to read the statute or what? I'm sorry.
what do you want, Daniel? I think, read the
It
statute.
is what it is.
Here it is.
You have to, when the county commission initiates the process of expanding the county commission, the law says that you pass a resolution like you did today, expanding the number of districts, and it has to be submitted to the voters at the next election, general election that's more than 60 days away. And so that's what we're doing. When that's voted on, then what they're doing is approving the resolution that you adopted, and it becomes effective when the vote is in favor.
Action is certified.
And then the statute says the governor, then you've got the process immediately to fill those vacancies. So,
There is a process stated in the statute how to fill those.
yeah, I mean, so if you did want this to be effective until 2022, then you don't redistrict until next summer. Because once you've done it, it has to go to the next election, and then if it's approved, then immediately you decide the method to fill those vacancies. So
That would include the possibility of 4 new commissioners if that's done.
depending upon when you do it, well, it could be 4 if 2 incumbents aren't running, yeah, as well as the 2 new vacancies.
Well, I think it's pretty well cut and dried myself.
But why couldn't you just create a resolution that states when it occurs and then that's what you're voting on? That doesn't, is that,
I don't think a resolution can trump state law.
It's not trumping state law.
It would be if state law says it has to take effective immediately upon certification to the Secretary of State's office.
Not seeing that here, but
If you go call Brian.
it's 19204.
That's the one statute, yeah. There may be,
Subparagraph C,
oh, sorry.
well, yeah.
So, I was seeing if there's another one. Additional statute.
Well, there are that discuss the process, like filling the vacancies and so forth, but I think this is the one that involves expanding the number of commissioners and when it's effective.
What's Jenna doing?
She's calling the Secretary of State's office.
Okay. Well, why don't we take a break here while that's being done?
10-minute recess.
10-minute recess.
Thank you.
And as of now, we do not have a answer yet, so maybe we could go on with county administrator.
Well, can't we? Mr. Chairman, I have a motion on the table.
Yes.
And at this point in time, I would move that we call for the question.
Second?
You can only do that once a meeting.
Well, we recessed and we started the meeting again, so that gives me.
That qualifies.
Okay, we have a motion and a second. We need to vote on that.
Okay, vote on the question.
On the question,
Roll call.
okay. Commissioner Friesen,
You're voting on the call.
Yes. Call the question.
No.
Feller,
Yes.
Yes.
It's strong arm. Second time
Huh?
second time one meeting, strong arm.
Yeah, we did. Well, you know, that's, call it whatever you want to
Okay,
call
so
it.
now can we vote on the question?
Yes.
Have to.
Okay, the motion now is to adopt a resolution calling for an election pursuant to KSA 19-204 on the question of a change in the number of county commissioner districts. That is the motion, correct?
Correct.
Okay, so I will call a roll call.
Commissioner Friesen?
Did you get any new information?
Some.
Can we hear what you have
Okay,
to
yeah,
say?
let's hear it. You've made special time. Let's hear it. Anyway.
Well, the Secretary of State's election office, I spoke with them, and they did say that we do have to defer to the legal counsel and what their opinion is. Once the results are certified, then it's official. They did say that. So
That didn't help much, but thanks for trying.
Okay, all right, so roll call.
Commissioner Friesen?
Yes.
Commissioner Sellers?
Yes.
Commissioner Hurst?
Yes. All right, County Administrator report.
John, make sure you frame the strong arm statement.
You gotta keep me, Daniel.
Just to give you a quick update, the ARPA Task Force, which is the local community group working for the ARP funds of the counties and the cities' money, they're now going to be working on some slides, guidelines, as they start then training and recruiting facilitators to have the special meetings that they want to have over the next few months. One of the requests they have to the county commission is the top 3 priorities. They framed it in top 3 priorities out of the county's comprehensive plan. That would be the top 3 priorities of the county commission of what you would want me to send back to this group, so that when they start having group meetings, they're going to have a PowerPoint, and it's going to, before there's too much discussion getting community input, just so they're going to let the community members know, here are the top 3 priorities of Reno County, and then the next slide is the top 3 priorities for the city of Hutchinson. So I need, in the next probably few days, next week, something from each of you of your top 3 priorities. If they're all similar, then that'll be easy. If they're conflicting, then I'll reach out to everyone. Right now, the ones that I've received so far from a couple commissioners are related to, and this is not specifics, but housing, economic development, and then water and sewer infrastructure.
Okay.
That's all I have now.
When's that due?
As soon as possible, so that we aren't holding up the slide. So if by the end of this week would be great. If not, get with me.
Okay. Commissioner Sellers?
Nothing.
Commissioner Friesen?
I wanted to, I just happened to hear about an incident at the county courthouse where one of the construction workers apparently had a heart attack or something, and wanted to commend a couple deputies for their work. Deputy Shelley Razor began CPR on somebody that didn't have a pulse, and Captain Blumenhorst had the presence of mind to get an AED that we had in the courthouse and put it on him, and likely saved his life. I'm not sure what his status is, but I'm sure those deputies do that all the time. But wanted to thank them for their work on that issue. That's all I have.
Oh, yeah. I just have one item, and that has to do with the motion I made today. And I think this commission is showing a tremendous disrespect to Reno County citizens for not taking under advisement and starting discussion with regards to the wind farm regulations. It's been 3 years. One commissioner said that he'd like to see this in 30 to 45 days. That was 60 days ago, and my object in making this August 31st is to give another 30 days. And I have not seen or been reported to any reason to delay any discussion on the regulations. It's past time, and I don't understand why we continue to put off making a decision. So that's all the comments I have to make. And so we will look forward to having lunch with the City of Hutchinson,
And,
City Council.
I was going to make, somebody texted me and said that the person that the deputies helped is recovering in Kansas City.
Good, good.
Great.
Yeah.
That's great news that I hadn't heard about, Commissioner Friesen, and they need to be recommended for that.
Yep.
So I think commissioners and staff really appreciates their quick, on-duty expertise in doing this. So I'm glad you brought that out. And so at this time, we will adjourn the meeting.